resume this county commission meeting on Monday, December 21st. We have a letter of resignation from the sheriff. And we also have stuff from O'Blighty, how to handle it.
What was that last part I couldn't hear?
A letter
Yeah.
from Harold.
You seen this?
Nope.
I just printed mine out.
I have an extra.
Oh, okay. I should have got my,
Grab
I
mine.
have 7.
Yeah, I thought about the same thing, too late as well. Corey just went to get his. Yeah.
I guess actually, the code just lays it out.
Yeah. Yeah. So the reason, well, wait for Corey.
Have you got this letter from Harold?
That's the one I just gave you.
No, I'd have it now.
I'll give you a minute to find it in the code. That's pretty good, I'm gonna do-
Good. How are you?
What Corey is looking up is the process that we have to go through with Brenda resigning. I mean, her resignation is effective Wednesday.
Hey Elaine, perhaps you could read the beginning of the email so everybody knows kind of what our starting point is.
This is from Harold Blatty, who is head of MACO. The process is set forth in 7/4/2206. When there is a vacancy in an elected office, there are no deputies for that office, so no, the undersheriff does not become the sheriff. You should immediately appoint interim sheriff, which may well be the current undersheriff, but could be anyone. That will give you time to conduct a reasonable research that allows for public participation in the appointment of the permanent replacement. We have always recommended that a county approach it as the same thing as hiring an employee. Advertise the vacancy and accept applications. Conduct interviews and make a selection. Since the vacancy would be created prior to August 1st of the second term, year of her term, that position would be up for election this year for the remaining 2 years of the term. And then he quotes the law again. Floor is yours, Clay.
Well, yeah, obviously this is correct. You need to appoint an interim sheriff. And then the question is, since we're finishing 1 year of a 4-year term, then there will need to be a special election with the regular election cycle in 2016. So that office will be open for filing in January, when other offices that will be on the 2016 ballot are open. There will be there's sufficient time for there to be filing in the regular primary and then primary to general. And this office has been designated a nonpartisan office, as all the county offices have. So that's that. So definitely should let the election administrator know that that office will be open for filing. When is the filing? Does it begin like first week of January?
I believe so.
Oh, it's
No, isn't it more around the 20th?
It could be, I can't
Okay,
remember.
whatever point it is, I think it's in January is when it starts, so.
I didn't mean to interrupt.
Oh, that's
And then
fine.
it closes sometime in March-ish.
Around the 27th.
One thing I've never had to look up is what are the qualifications to be sheriff, so that's what I'm scanning for. There's qualifications for deputy sheriff, but I don't know that they apply to sheriff. I guess I need to find out.
Yeah, I
Do
think
they?
it's separate.
Do they still have to, do they have to be a law enforcement officer and all that stuff?
We dealt with that a few years ago, 2010, I think, and it's as open as any other elected official, except for county attorney. 18, live in the county.
No felonies,
Hmm?
no felonies.
Breathing,
What?
breathing.
There's an appointment.
Hmm. Well, very interesting. So the question would be, if you appoint somebody, you know, whoever it is needs to understand that it's basically a 1-year deal. And then if they want to keep the job, they've got to run again. If they don't want to keep the job, then they won't run, and they'll be out at the end of 2016, and then whoever's elected will take over, so.
Since we just got this letter today, and this is effective the 23rd, Wynn just walked through, he's the undersheriff. It seems to me it kind of makes common sense that we would appoint the undersheriff to be the interim sheriff. If he comes back through, it would be nice to ask him if he's willing, but is that required? I wouldn't think so, but.
Those are actually two different items. Anytime something happens to the sheriff, the undersheriff is the acting sheriff, right?
Right.
But that doesn't mean that the undersheriff is automatically the interim sheriff. The
No.
commission could certainly go, okay, you are the interim undersheriff, and make that decision, but it wouldn't be the automatic thing like ordinary, like it would, you know, the sheriff resigns, the sheriff retires, the sheriff, you know, I don't know, passes away or something, the undersheriff automatically has to step up and take those duties, but then the commissioners have to, as soon as possible, make that decision, so.
I can see a deadline, maybe there is a time frame,
I think sooner the better.
Harold's email has immediately in all caps. You
I saw
should
that.
immediately appoint an interim sheriff, and that's why I felt there was some immediacy.
I wonder.
it's okay with you, Elaine, ask Wendy or Brooke to maybe intercom him and ask him to come here. I would hate to make such a motion without his at least being aware and asked. And if his answer's no, then we go to plan B,
Mhm.
I would think.
Either way, I don't think you can make that decision today. You can make it, as soon as you can make it is Wednesday. I think you'd wanna at least advertise. Does that make sense? I think it makes sense to inquire if he's gonna
Yeah,
reject.
she's still sheriff until the,
Yeah, was there any was there any reason given what for her resignation?
yeah.
Is it public knowledge?
Yeah, it is. It was read off in the meeting this morning,
Oh, okay.
but, it could be read again if you would want to.
I'd kinda like to hear what the reason was. That's not too much trouble.
Hey, Corey,
Ann's gonna go get her copy.
while we're waiting on that, this wouldn't fit under a emergency situation where we would act, get this done so that this is in place in time for, well, and we could meet again Wednesday too, I don't know these guys' schedule, but, and then agenda it for Monday and make it official, just like we would an emergency in the
So it's
county,
the date, what's the effective date of her retirement?
the
23rd.
23rd.
So that's 2 days away. So you have time to notice it for a meeting on Wednesday. Or you could notice it for Monday and he would be the acting sheriff
Right.
until then.
Mhm.
Okay.
Well, the interesting thing about his letter here is it says you should immediately appoint an interim sheriff, which may well be the current undersheriff, but could be anyone. That will give you time to conduct a reasonable search that allows for public participation in the appointment of the permanent replacement and treat it like hiring a.
So in other words, there needs to be public notice. To be able to have public participation.
Hi,
My electric leash didn't go off.
hot seat, this is hot seat day.
Yeah, good luck. It's up there.
Watch, we have a button that pulls it.
Oh, I was just having a conversation about this.
You're not the only one.
Do you wanna see what Harold said?
Sure. Harold Blatty.
That's the one.
Oh, the man, the myth, and the legend.
Turns out I had one, Ann. Sorry about that.
Okay.
No surprises.
No, I actually knew that,
So if I may, Madam Chair, are you interested? And if I were to, or no, we'd have to post Wednesday to have a meeting if both of you are available to do that.
Because one of the problems is, and that's what I was talking to Doug, is the authority that the sheriff deputies and the deputy coroners work under is Brenda's authority. So once she vacates the office, then those guys aren't gonna have any authority to do their job. And so something has to happen right there. And so, everybody will have to get sworn in again under an interim. And then my understanding is then it goes open, and you have to apply for it, and then there's supposed to be hearings on it, so. That's my understanding of the whole concept. And my stuff is almost done, so.
But you are willing,
Oh, yes. I've been doing it for, yeah.
quite a while.
After 19 and a half years, I'm going, I'm done following.
So, we don't do anything today, motion-wise. Post it for Wednesday, 10 o'clock.
Mhm. Are you okay with that?
I think so.
The other question I have is, and perhaps we need to decide this, have you seen the succession plan? When, I want to just verify that we need to vote on this as well. This was done in 2014, and what we have is a county succession plan, and it was vetted through Mike Saystad, who was chief legal counsel at Mako, and it was to do exactly what Harold Gibbs just said, and that is increase transparency. This is a succession plan for filling a vacated office of a Broadwater County elected official. It is based on Montana Code Annotated. The purpose of establishing a plan is to maintain and maximize transparency in the process, welcome the input of the public, fully vet a potential representative of Broadwater County citizens, and make every effort to ensure the most qualified person is appointed. This policy is necessary as Broadwater County is a nonpartisan county. So what this policy would do is, I'm not sure about this position, this would be a question for Corey, but regardless if the decision falls to just the commission on who is hired, this would actually put every elected official in the county as part of the vetting, interviewing team, and each one would give a public statement or opinion as to who they think is most qualified. And it's just a way of getting a more broad look and making sure it's open to the public. So I guess my question is, it is a couple years old, but can we do this, and does the final decision fall to the commissioners? And do we have to vote to follow this on Wednesday as well? Does it need to be, because we should get this advertised, I would think, as soon as possible, and as widely as possible, again, for transparency.
Well, first, I mean, the statute says vacancy in all county offices except county commissioner must be filled by appointment by the Board of County Commissioners. So, I mean, it's
Okay.
your decision ultimately to do it. I think that, you know, all these folks can participate in the vetting. I have a hard time seeing how you could require some of them to give a public statement, for example, Justice of the Peace. Justice of the Peace has to work with whoever you appoint as sheriff. So stands up and says, I want Bob, and you guys appoint Joe, and now that there's an issue there, same with the county attorney, I've got to work with whoever, so, I think I understand that there's certainly some merit in terms of kind of everybody having some kind of a role in assisting, but,
Wouldn't an appropriate public comment from a county attorney or justice of the peace be, and please keep in mind that this person needs to have a strong knowledge of criminal law, or, you know, something like that to remind us of what it is that you need, even though you wouldn't necessarily be saying, Joe's my pick and my only pick.
right.
I don't think that was the intent, but more to have a voice of all elected officials, if that makes sense. Would that work?
I think it's fine in terms of, from an advisory point of view, if the decision is the county commissioners to make,
Yeah.
so.
So if we meet Wednesday at 10, we can appoint Wynn right then as the interim, right?
Well, you can, I mean, one thing that I'm looking at in this statute, commissioners may appoint a person to serve as an interim officer for the time period between occurrence of the vacancy and the date on which the vacancy is filled pursuant to this section. Okay? Well, according to this section, if it's an elected position, then the vacancy is filled by a special election. So that's fine, and you can certainly do that, just keep in mind that's different than what Harold's saying. He's saying do a application, vetting process, whatever. You have to have somebody that's carrying the authority of the sheriff going forward. Does that make sense?
Yes, but he also says that person, of course, will stand for election.
Yeah, oh yeah, yeah. Election has to happen.
So you're saying what we could do instead is just appoint an interim sheriff through next November
I'm saying
just
that's
give a
what your
hiring.
appointment would be.
process.
That's what your appointment would be.
So you wouldn't have to go through the interview process and all that?
Well, you don't have to, you know, commissioners don't have to. Apparently, he's recommended that, I guess, but
I think maybe for the sake of more public input. And then if you do have somebody who's been appointed, they walk and talk with more authority that's gone through the process.
and then they have to
Regardless.
decide if they're gonna run or not, you know.
Right, right. Okay,
I need to do a little more research on this to make sure, because it could be that you could appoint somebody now, do the application process, which could take a month or whatever, and then whoever you pick in that next round is through the end of the year. But I think the way this is saying it is if it's an elected position, that the election, or the way of picking somebody for the rest of the term is the election. Your appointment now would be now
Mhm. You're still interim.
through it'd be a year. It's now through January, or December 31st of next year, because someone elected on election day is going to take over January 1. Actually, for a special election, maybe they take over right after the election. I'll have to look at that.
Elaine and I both did.
Did they take over right after the election, or
Mhm.
at the beginning of the year?
They were vacated seats, we both started November
November.
11th. Yeah.
Okay, right after it was certified?
Mhm.
Okay.
Okay.
It's coming fast.
Yeah, been coming fast.
Thanks, Will.
So Wednesday at 10.
You good with that?
I'm good. Oh, yeah.
You sure?
I didn't know you were waiting on me. I have court, so I don't know if I'll be here at 10, but you don't need me, so.
Mhm.
I think we know what we have to do.
Go ahead. Okay, so the other thing we have is we have our two nurses from the public health office have both resigned effective essentially the 28th because they'll be on vacation. And so the question is, how do we maintain a seamless flow of services for our citizens who use those services? We don't want to break in their services. So just as a curiosity thing, I contacted A to Z Staffing Solutions. They could provide us with an RN who is WIC certified as early as the 28th, so that we would have that, that office filled without any breaks. And probably that would have to be noticed for Wednesday as well, to sign a contract and get that to them, but they also need that signed as soon as possible so that they can do this unless there's another plan, a plan B. Their contracting rate would be anywhere from $27.79 to $30.27 per hour, and this is up to 120 days, so it would give us 3 months to figure out the process that we need to follow. So whatever's the pleasure of the board, but,
What's your thoughts, Corey?
Sounds like that's what you need to do. I mean, I don't know that my empathy what's needed on this. That gives you the ability to maintain that capability and unless there's a better option out there, but
Which I'm open to. This was just the only one I could think of. What we need is something fairly quick, since today's the 21st, it's 1 week from today.
Can you ask the people if they can reconsider their decision to quit and maybe stay on until you can get somebody permanent?
That might
I
be,
think that's a good idea.
I have a question. What happens after the 120 days?
It'll be filled before that.
And what happens to the Department of Health? Does it stay as it is with the new director
Right now,
Or
it
does it-
is.
right now for the 120 days?
I can't say that for sure. But it would for right now, yeah.
But I'm wondering what happens to the Department of Health down the road.
We'll always have a Department of Health. Always.
Yeah, that's a lot.
Mhm.
You have to have one.
So,
Can you maybe address what the plans are for the other services that are provided?
Through A to Z, with the WIC certified RN, what we would do if we want to go this route, and having an agreement today, Corey, you'll have to direct us on this, gives us a couple of days to contact DPHHS, but since those contracts are with the county, then we would just direct them to this person who is going to be filling in for this interim time period. They would go ahead and continue those services. So, I'm sure DPHHS would have some direction for us at that point, but, yeah, we would have to work with them. So, I don't know, this is new to me, I don't know if you guys know anything more.
Yeah, Madam Chairman, I have a comment.
go for it.
We shouldn't even have to have this meeting. Linda Campbell handled that office for 20 years. There was never any problems. She come to us, said that she's gonna be retired, and she had Misty and Claire there that were very capable of handling this job. So, all of a sudden, underhandedly, one person, one commissioner, starts working, moving everything over to the hospital, has secret meetings, and now we're in the one hell of a mess where we are right now.
Franklin, there's some very much untruths in what you just said.
There is no,
Yes,
I got
there
everything
is.
right here. and
I don't care what you've got there. There's definitely some untruths. It was not one commissioner.
Was you involved in that?
Yes, I was.
Was you involved in that secret meeting?
I don't know about a secret meeting. I don't know what you're
Okay,
talking about
that's-
there.
That's one right there.
I have a question.
Yes.
What sort of input, I noticed in the newspaper article, Mar and, what's the other county that's involved?
Jefferson.
Yeah, what sort of input or leverage or whatever do they have in this?
Mr. Trice,
Sure, and-
answer that.
I don't believe they have any.
But we serve them, right?
Mhm.
And there's not been any talk of dropping them.
No, I just wondered if, we had to consult them or ask them any questions.
I would imagine we would want to if there were a plan or a desire to drop them, but that hasn't been addressed or discussed, or I don't think even thought of at this point. But yeah, you'd want to just out of respect for sure. Yeah.
I've got a question.
Harold?
Now, is it a fact that the health department is pretty well funded by grant money?
Pretty well, not entirely.
Not entirely by grant money?
Yeah, and that is
Everything
going to
except
change.
my wages was. Everything, Misty and Claire were covered with grants. My wages was what the county liability was my wage. And I did not make $27 an hour.
I do have a copy.
Well, the question that I have in regards to that is I consider the hospital like a brain dead person on life support. With the commissioners and the leader of the hospital, being the doctors. At some point, is my opinion, somebody's gotta make a decision to pull the life support plug. Because this is, you guys are all responsible to the county and to the taxpayers of this counties, not just to your own wishes. The thing about it is that sooner or later, that place is unsupportable as far in the method it is right now. To me, that's all you guys are trying to do is force grant money over to Kyle Hopstead. That's the way I look at it. Might be wrong, I might be wrong. I've been wrong before. However, that's my opinion.
I second that.
I don't think that's entirely right, Harold.
Well, it might not be entirely right, and I'm not saying that it's not
We're all
entirely
entitled
right.
to our own opinions.
But like she said, it's been running, I've been here for 27 years now. And she's gone to the health department plenty of times. And never had any problems with anybody that worked over there or anything else. And it looked like a seamless organization, no problems, didn't have any problems as far as in the public eye. Now it does. Now, who put their finger in the pie? I don't know. However, it looks like somebody did.
Absolutely, you're 100% right.
Just on the same subject, Commissioner Obert, can you address in your letter to the editor that you posted to the paper in response to Linda's, you commented that Harbin County's cost for public health was around $58,000, and you mentioned that ours was double. Can you please explain that?
I can, and I will do that with the budget. This budget unfortunately does not have in it the personnel costs for the public health supervisor.
Public health supervisor, I made 9 cents more than Misty.
But yes, I can address that. Just give me a second to find the right. Which one is it?
Corey?
I need to take off in 10 minutes, so I just want to make, if there's anything that I need to address before I go. Is there an option to, since Nurse Campbell just retired, is there an option to have her cover it for that interim period until a new person is hired? Have you explored the option?
She's sitting there shaking her head, no.
Shake your head, no.
I've had enough for the county. I'm not gonna fight this. I feel like I have been betrayed by Laura, because Laura told me that Misty had wonderful ideas, and they gave Misty, they advertised for her position in-house, they did the interview, and then they did not let her know, I don't know, 2 or 3 weeks, so she went over and talked to Laura about what is happening. Laura says, go to Elaine. Elaine says, go to the HR person. And then we find out, all this here time, that they're talking with the hospital. Misty didn't know about that, nobody knew about it.
First I knew about that was that HR sent that letter to Misty and said that the county's they're gonna turn this over to the hospital. That's the first I heard of it too.
Because I know Laura told me that Misty had wonderful ideas with the county, and new ideas, and we needed, because I am old school, Misty knows all this electronic stuff, and she had wonderful ideas about making it better and more efficient, and she's not even gonna get the try. But the application, it was advertised in-house, and then somehow, it was never, nobody let her know.
Why?
If I can answer some of the questions and start, there's a lot of questions that are in line. I think we need to take one at a time.
I'm just laughing.
As far as personnel issues, those are closed door. We don't share personnel with the public, we don't gossip. And certainly if Misty wants to have us sit down, I would be fine with that.
I'm perfectly fine.
But
with
I'm
that.
gonna talk about the budget, because that was the first question, then we can address the others. I have the budget detail report from December 9, 2015, and this is for the general fund. The budget is for $60,000, and that is not including for the supervisor. So the supervisor, if you do $25 an hour, you look at a rack rate of about $71,000. Right there's 120. 58, 120, ours is about double that. The other thing that you have to take into account is all the matches for WIC, MCH, bioterrorism, home health, and immunization all come from PILT.
There is
That's-
only one match.
There's two matches.
Okay.
There's $6,550. is the
Okay,
total match.
I talked to Debbie, I could go back to Debbie and ask her again, but, maybe it is just two of them. That still comes from PILT, it's still county money. So, it may just be a little bit, it may just be $6,000. That isn't the issue. What we're trying to do is just do more for our citizens as cost effectively as we can, period. If there's a better plan out there, we owe it to the citizens to at least look at that. If we look at those other plans and come back and say, nope, what we have is indeed the best fit, it's doing the best job, then we know we did our due diligence, we did our job, and we know that, and we stick with that. We should not be afraid to look at other ideas. Whether we adopt them or stick with status quo, at least we look. That is our number one job as managers, and it's budgetarily responsible. So
Linda
that's-
already had this, everything was set.
If we're gonna do that, then why aren't we doing something with the hospital as far as you're handing PILT money over there, right and left? And it ain't no $6,000.
Close to $1 million.
You know, if you're gonna be responsible for PILT dollars and you're gonna bring that up in a conversation, we need to have a conversation about the PILT money then.
And I believe those are public meetings where we take public comment.
They are.
Well, you're talking responsibility to the taxpayers though.
Always.
I can't see it.
I had that office when I go over there, I had two very qualified. They went through all these hoops for me. Both got certified so they could do WIC. They did awesome, and they have run it, and the meeting last Monday, you stated that for 3 RNs, there wouldn't be 3 RNs. We had this discussion, Laura, you know, that these two would run it without, and there was enough money.
It didn't
There
work.
is enough money in there for those two, and it didn't work because you don't want it to.
That's not fair. You have no idea what that discussion was or what led to it. Those are closed door. They're privileged for the protection of the
Who were you
employee.
talking to? Who was the closed door about? There was no personnel in there. These girls were not in there.
Go
That
for
one.
it.
I just have a question while Corey's still here.
Okay.
Okay, my experience with the public health department when I was working with visiting nurses and stuff in the county, was that they operated under certain jurisdictional provisos. In other words, you know, if somebody, Joe Blow has a dirty kitchen, I think it was the health department that shut them down, isn't it? If there's something, you know, like contagious, I remember the public health nurse coming up and whacking the quarantine signs on the door when you had measles in the old days. You guys are too young. But my concern is, okay, what if, and they're within the hospital, who's going to govern whether the hospital kitchen gets shut down? Or whether there's a disease problem there, something contagious, if the public health department is under the jurisdiction of the hospital and is supposed to be policing part of the hospital's stuff. Wait a minute, you know, it seems to me like there's a conflict there. And the other question I have, I don't quite understand, is it going to save money other than the fact that you're gonna have a different physical location? Is it, if the public health department is doing the same thing they did before, I'm a little bit slow, you know? I don't understand how you're gonna save money. Is the public health, are the nurses then going to be serving the needs of the hospital also? Is part of their job gonna be doing hospital services as public health nurses? Are they going to be also hospital nurses? Does that make any sense to you, Elaine?
It does.
You know, I'm concerned that you might have dissipation of services also.
Julie, are you the one that inspects the hospital kitchen?
Yes.
And she's not under the public health. department, she's a department of her own. and a department head.
It's all part of. Yes, she is under
Department
the
of
health
Health.
department.
There's public health and there's
Sanitary is
environmental health.
under the health department.
Well, she's supervised by us, I guess that's what I meant. She works very closely with you guys, yes. But she's supervised by.
There's one health department. There's public health and environmental health under the umbrella of public health. Or the health department.
And yours is environmental health.
Right.
Okay, so who governs dirty kitchens? That's my question. Who has the say-so?
Julie does.
The public health department, right?
The
I
health
mean,
department.
yeah, the fire department isn't gonna go in and say your kitchen's dirty, right?
Can you just go back to your comment about the budget? So, I just feel like what you put in the paper was a little bit misleading, because you indicated that it was, basically you're saying that the county's cost is double, so you would be saying that you contribute $120,000 around for the cost of the health department, which is untrue. For the last 3 years, in fact, this year is less than last year. Last year, the general fund was $70,000. This year, it's even less. And Linda, what she submitted for this fiscal year included her hours up until January and a market adjustment for all 3 employees. And it was still less than what was contributed last year from the county. So I'm unsure how you feel that we're costing you double $58,000. Not to mention we have revenue that we generate from our health department for billing services, which also contributes $20,000 that was budgeted this year, the general fund. So really our cost to you would only be around $40,000.
All I'm going by is that budget sheet. I'd be more than happy to get you a copy of it. Good, perfect. Maybe you and I could sit down with Debbie if you want, but that's what the numbers say here, and 60 plus 71 is, pretty close to double 58.
So when Linda submitted her proposal for their budget this year, it indicated on there that the health department was gonna be ran with 2 nurses.
That is something that the HR team worked on in a closed door session. It is not for public consumption. I'm not gonna go into it. It was a great plan. Unfortunately, it didn't work. That's all I can say on it.
Because you want to add more dollars there to put the hospital in getting paid for a supervisor, I guess.
Can you
It's
maybe,
okay to say that, but it's not true.
can you
It's
maybe
not true.
elaborate on what was said during the meeting between you, Kyle, Fran, myself, and Clara, where you indicated that there was gonna be, you kept saying it was gonna be a cost savings, but in the long run, all the grants and the funding stayed the same?
Absolutely. If administration of the public health employees was handled by the hospital, then that savings would be to the county. The hospital already has administration. The model that we were looking at that point was Carbon County, and the public health nurse answers directly to the CEO of the hospital. So if that were the model, then we save on that administration cost. They already have the cost. There's the savings. The other thing with that model is the public health building doesn't change. The nurses in the public health office, nurses and staff, clerical, are in that same building. So our public health building would still be filled with public health employees. Their administration would be under the hospital. Therefore, there is the county savings because we're not looking at having to hire a supervisor with county tax dollars. The other thing with that is perhaps we could offer more services. I'd personally like to see cancer prevention and the tobacco cessation that we talked about. There are some opportunities. Now, regardless of the hospital model or the county model, there's opportunities, something that we can look at regardless. But that's where the savings would come from, it's just that administration.
We had tobacco cessation. It was a tri-county grant, and Lewis and Clark County had, because it was tri-county, and we did not get much of anything. We have a little packet over there, but for the services I had people trained to do that, and everything was in Helena. We did have tobacco cessation, but when you have a tri-county, most of it stays where the grant is
Managed. yeah,
Managed.
right.
Yeah. And Boulder and, Jefferson County and Broadwater County got a very little bit of that, what we did have. And we do have a cancer. We go into Lewis and Clark, and they have a cancer meeting every 3 months, I think it is, that we go in, and we are part of that.
Can I ask you a question, Lee?
Mhm.
Do you have any problems when he's going to, talking to Debbie on budget and stuff like that?
No, Deb and I always got along fine.
I'd like to read something off here.
Can I need to leave. Sorry, I'm already staying a little longer than I was supposed to.
Okay,
so
it's
just-
kind of involved, just a little, well, if you want to hear it.
I'll
Okay,
stay.
this was sent out December 11th by Obert to Corey and Michelle, and she says, I should have included you in this email. Well, I got it yesterday. And she says, Corey. Huh? Oh, okay, I thought you said something. Corey, while looking into the public health budget and asking questions about expenditures, I learned there was an argument during the budget session between Linda Campbell and Debbie Kelly. Linda wanted to keep her salary out of the expenditures so her budget looked better and could justify the market adjustment she was requesting for her staff. Debbie said she didn't want the fight, so we relented with the understanding there'd be some vacancy savings and the balance would be taken care of in the amendment process later in the year. Nothing was mentioned to me about this until today, according to Obert. The market adjustment wasn't given, as Linda said she intended to cut in from the department grants. I had asked Debbie to verify the grants allowed for this, and she said they didn't. The requested market adjustment was denied for that reason.
Now, that's an untruth right there. Debbie and I have never, ever had any questions about anything. I have never said anything back to Debbie. And you know that, Laura. I have never said anything to Debbie like that.
I don't know that, and that's the.
Did Debbie tell you that?
I would like a copy of that for the public record,
Well,
frankly.
there will be, everybody in the public can have one of these. If everybody here wants one, I'll make sure you get a copy.
And I would also like to say that, in my opinion, that should be a closed-door discussion.
That wasn't closed door.
It certainly should be when there's something that serious.
Well, you're the one that sent it out.
I wasn't privy to that conversation. The best I can do is put it to the team.
It wasn't privileged.
And look
To who?
into it.
I mean, who had the conversation? Debbie and I have never,
I
ever
have no
talked.
way to know that, Linda, but
How
when I
did
hear
you-
something that serious, I can't just turn a blind eye and say, I don't think that ever happened. I have a duty to share it
Okay,
with
you
these
do
folks
your-
and the county attorney and our
You do
HR
your duty.
consultant.
Debbie and I have always got along.
I was
Do I have to read
not
this
at
again? Don't you
all.
understand what I just read?
Would you wait a minute? Somebody else is talking. Don't be rude.
Try not- Sometimes you
Well,
have to.
don't be rude.
I have a copy of what Linda submitted for her fiscal year budget proposal, and her hours are in fact included on the budget proposal.
Oh, I'm sorry, Corey, I hold you back.
I'd like to see that because that's information that we need to be aware of.
And I also have a copy of the preliminary budget that was sent to us by Debbie that indicates on here that it actually says, based on reduced hours due to Linda's retirement, this also reflects the remaining staff absorbing her duties and not replacing the position, and it also reflects a market adjustment request to $24 and $26 an hour for budgeted of $37,000 for the general account, which is in fact less than it was last year with a market adjustment. Which brings me to my next question. Can you please discuss why the market adjustment was denied? Because we were never notified.
I will address that, because when I went to Debbie and said, do these grants allow for this? She went and researched it, and she came back and said, no, they don't. Most grants don't allow for increases in pay, that's up to the employer. That was the reason.
It's budgeted into the general fund. It's on the budget sheet.
That doesn't mean that we're going to still go back and do something that the grants say you can't. So,
This
again,
has nothing
it's
to
a
do
full
with the grants.
commission on 1/3.
This
That's
has
my
nothing to do
opinion.
with the grants.
Corey?
So I need to leave. I just want to kind of refocus on what apparently needs to be decided today, which is a decision on coverage from the 28th on until replacements are hired, number one. Number two, I think it's very clear that you cannot advertise for replacements if they don't know if they're gonna have a job or if that department's gonna get put into the hospital. So the commission needs to make a decision on that. That needs to be a decision that is public, all the deliberation on that needs to be public, none of that should be closed door. The items that are closed door are closed when the interests of individual privacy outweigh the right of the public to know. Those are very limited, that would not be one of them. And then third, if there are issues of personnel that involve Misty specifically, that she can waive her right to privacy in order to have those discussed publicly. I would recommend before that happens that she be told privately what the issue is, so she can make an informed decision on that. So I would recommend we don't do that today. This meeting is about to evolve into more of a fight than it currently is, so I would recommend we focus on the decisions that need to be made right now, and that the commission make no hasty decisions about the future of the public health department. Make it soon, but don't make it hasty. I think there's a process to go through. And that I would recommend that you have a conversation with Misty and Clara to see if they would be interested in staying. But obviously there's some issues on the table that would need to be dealt with first. And with that, I'm 10 minutes late, so I need to depart.
Thanks,
Thank you
Troy.
for being here, Troy.
Thanks.
Carol?
The thing that I would like to ask is, has anybody looked at what things are like over in Florence? And because there are basically a Class B school, so I don't exactly know what the size of that town is, but it's gotta be fairly close to what it is around here. And I know that like St. Patrick's over there, they have a clinic down there in Florence. That's what they have in Florence, is a clinic, because I know my daughter works there. She's a PA over there, and they don't have the issues over there, it doesn't seem like, that they have in this county here. And like I said, geographically, demographically, it might be about the same number of people that they're being served in that area. So, I don't know what the big thing is about having the hospital here, because if they had something like that, and like I said, it's in proximity to Missoula, just like this is in proximity to Helena.
We'll have to do some checking into that.
You know, I agree with Corey, we've got something we need to address, but the thing is regardless of how you feel about the hospital, let's just take that off the table. Our responsibility as managers is to evaluate every department, make sure that they're doing all that they can for as little money as they can. We did our job as managers, and you know, I'm not gonna apologize for that. We do it with every department. This is the first one that we've got such amazing pushback from. That doesn't, when you evaluate a department, it doesn't mean that somebody's doing a bad job. In fact, I've sang your praises multiple times. Here's to Linda. This is our job, and this is why it's lonely at the top, and this is why we get used to having people mad at us. But this is just us doing our job, period. So that's all I'm gonna say on this subject.
I'm not mad for it. I'm
Carol.
disappointed with you. That's it.
I wonder why it had to change.
It
It was
hasn't
going
changed
just
yet.
fine.
This is just,
Yeah,
Looking
it's
for
about to
information.
change. According to what the newspaper says and things like that, it's about
you
to
can
change.
believe everything you read in the newspaper?
Well, it should be true.
I don't.
Sure opened up a hornet's nest.
Bobby didn't say it's going to change. Bobby laid out the facts for people to
Yeah.
read and be fully informed. That's it. That article does not say things are gonna change. So it's an opinion, it's not a fact.
Are you saying, Laura, that the budget, that they were costing more than they should?
No, Carol, I don't know where you would ask that question. What we do as managers is we look at every single department, every employee, we try to maximize services and cut expenses. That's our job. That's what the taxpayers want us to do. That's all we're doing. If at the end of this, we go back to what was, fine, at least we know we looked at other things. If we do something a little bit different, we came to that decision by facts and evidence and data. That's what we're doing. We're collecting data, we're interviewing, we're collecting evidence. That's it. That's our job.
I don't hear the numbers. Her numbers are different than your numbers. Why? Why?
I don't know, but I'm certainly going to look into it, and you're more than welcome to a copy of what I've been looking at.
Harold, whoops.
I just want to say something. I sent Laura and both, I think I sent it to you also, Elaine, last year, because we were talking about the mosquito and the weed people. and how much money it was gonna cost us to have a building and a place and a bathroom and a chemical storage area and this and that and the other. And I suggested to the commissioners that we should look into contracting those jobs out, because we wouldn't have any liability, we wouldn't have to worry about another building, we wouldn't have to, the thousands and thousands of dollars that you guys have already spent now, instead of contracting that part out. Not only that, but the health insurance and the pensions and everything else that goes with it. And that wasn't taken into any consideration that I can see, because if you guys would have looked at that, you could, if you wanted to put a pencil to it, you could see that it would have saved the county a lot of money.
We don't have a building up, do we?
No, I heard you bought one though.
Not for what we want.
Madam Chair, with all due respect, we have an item on the table, and we're getting really far.
Yes, we are.
Anyway, I just wanted to bring that up as far as the input from the county. I think that we should be looking at things like that.
Okay, thank you. John?
I have a little experience with the AV department from many, many years up on Indian Creek. And the incompetence of so many people that's been appointed by the county to do their duties up there, and how they've acted to hire on a responsible, reliable, well-trained officials is not only a savings in the tax dollars, it's savings in guys like me, and my health problems right now is because of weed control, including spraying over my head with a helicopter that nobody was managing, and being sprayed along the road with things that people that have no idea of how dangerous or what they're doing, and our weed man is one of them. Thank you.
Misty?
So I just want to go back to the market adjustment. So your comment saying that the grants would not allow it. So are you indicating that the grants don't allow you to determine when an employee is compensated, or that there wasn't room?
There wasn't money. A lot of times the grants have specifics in them as far as what a person will be paid. Management can pay more if they choose. The fact that the justification for the market adjustment was it would all be covered by the grants, and we had our accounting manager say, no, those grants don't work that way. We had to go with the accounting manager and say no to the market adjustment, because the justification for the cost was not allowed under the grant. The market adjustment was not brought to us as we can take it out of the general fund because this is the place where I will have the savings. That would have been a different conversation.
So that was what was put in the preliminary budget, was that it would be partly covered by the general fund. And if that was the case, then why would you offer to provide a department head raise to Linda in a private meeting that you had with her? And then why would you offer to then give the other employee working there her 6-month probationary increase instead of a market adjustment, leaving the other employee if it wasn't going to leave room?
There is absolutely no secret, nothing private about any of that. That's all out on the public table. Had Linda come to us and said, I want to do this market adjustment out of the general fund, or out of my general fund, for that department, not the entire county, and could justify it, it would have been a whole different conversation than the grants will pay for this, because the grants didn't allow for that payment. So yeah, I did. I came up with a creative idea. I went to Linda, and it was all based on your plans of who would succeed Linda in that department. I think it was a very well thought out plan. I think it would have solved all the issues in that department. Plan C could have been coming to us saying, this is where I have the money, not in the grants, but in the budget. That never happened. So we responded, the commission responded to just the information we were given. What Linda and I talked about never came to the commission, therefore nothing could be acted on. It has to be a commission decision.
Did it not come to the commission in the preliminary budget? Because the wage increase was throughout the entire budget.
You still
including
have to
grants
have
and
the
general.
commission agree and vote in public to raise an employee's hourly salary. That was never done. Even though it was in the budget, that's fine. That doesn't mean you're automatically gonna be paid that. That's not how it works. You still have to have a vote of the commission that says, we approve a market adjustment for such and such to this amount.
So,
And I showed that. And the grants, there was still in the grants to run the grants how they were supposed to be, but you can pay your employees. I don't know where you're getting that the grants say that they can't be paid, because that's where they would have been.
My guess is that most grants have an admin of 5% or something.
No.
Well, I don't know the grants. I went to the person who does the budgets. I asked her, she did some calling and research, and she came back and said, no, the grants do not allow for this. I'm not going to go to this commission and argue to override that, because that would be illegal. So,
okay, so go back to the 6-month probationary increase. Is it not still the right of that employee to get that increase, regardless of whether we had a market adjustment?
that is up to the department head.
And you are a department head?
No, we were not at the 6 months. We are now. Well, for a few more days. Yeah, that was not our call. We were not the department heads at that time.
So I'm requesting for you to please give her that market adjustment, or that 6-month probationary increase then.
Thank you.
You talked about these market adjustments.
No, I'm talking about.
No, I mean, I got something to say about these market adjustments. All these other ones come in, bang, bang. Solid waste got a big $2, in fact, I think got 2 in the last year, I'm not sure on that part of it. There's never any problem. You two are the only two that didn't get.
My other comment would be, during that meeting, you indicated that you weren't giving whole departments raises.
That's
You-
not true, Franklin. Everything you said is
indicated-
false.
Ms. Gilbert, that you were only giving department heads raises at that time, or market adjustments. That's what you indicated to Linda, correct me if I'm wrong.
No,
And
no,
so
that is
I don't
not
know
what I
how we
said,
went-
but I will tell you what I've said, and believe I said then, and have said since. I do not believe that employees in a department should be making more than the department head. So for a staff to get a raise or a market adjustment that is above the supervisor, I think you're biting off a real bad managerial problem there. So my thoughts then, I think, and I can't tell you exactly what the conversation was, but I'll tell you my philosophy now, and has been for a very long time, is your department head has to make a certain amount above their employees. Otherwise, you have morale problems, you have all kinds of problems. It's been my philosophy for well over a decade, so that's what I believe I said at that point. We did have a request just for you guys to get a market adjustment, and I said, no, it has to go to the department head as well for those reasons. And I still stand by that.
I believe the budget included all of us on our market
It did.
adjustment.
And I submitted 2 different budgets, so I would make $2 more than these 2, and it still was covered. I submitted that also.
I hear that there's a lot of anger over not getting more money per hour. I would like to go back to this. That's way off the topic of public health. We have an issue that we need to address, and we need to know how we're going to address that.
And you're gonna be paying somebody else, because you're gonna give these guys a market adjustment, you're gonna be paying $27 an hour, and this person isn't gonna know our clients over there. I'm thinking about the people that aren't gonna be waited on either, like they're used to. They're not gonna know anything about the grants or anything. There's deadlines coming up, and I know that when you hire somebody, I'll just mark my words, I bet they get $27 or more, but these girls couldn't get 24. Okay, I'm not saying another word.
So, do we want to table this until tomorrow? Do we want to Wednesday? That gives us very little time to follow through, but I'll just let them know that we're on hold until Wednesday, and maybe if there's some other options, we can have those to discuss and then make a decision Wednesday. What you want to do?
Good idea.
All right.
John?
I'd like to address a statement to Mrs. Cabell. Is there any possibilities you could come back in and act as a temporary guidance.
And work with this. I think.
No, we can remove her.
I think nothing.
Would you consider it if,
I am so disappointed because I trusted everything she told me and it's not coming. So
well, you're not the only one.
I'm not gonna go there. I will not come back. No.
Well, don't do it for them, do it for us.
Meeting's adjourned.
I like your pushing.
What time is the meeting on Wednesday?
10.
Now, why is Brenda resigning?
Remember I said right to start off with, what a hell of a mess she put us into?
What?
There it is.
Oh, Ann asked what time it was for the minutes.